Selective serotonin reuptake inhibitors are among the most commonly prescribed medications for treating mood disorders like depression and various types of anxiety. However, one puzzling and challenging aspect of starting SSRI treatment can be the initial exacerbation of anxiety symptoms. While SSRIs aim to relieve anxiety by increasing the levels of the neurotransmitter serotonin in the brain, some people experience heightened anxiety when they first begin treatment. This is a paradox that has puzzled both healthcare providers and patients alike, and it has prompted a good deal of clinical research. Studies published in respected, peer-reviewed journals like the Journal of Clinical Psychiatry have often reported this increase in anxiety during the early stages of SSRI treatment. While serotonin generally promotes feelings of well-being and happiness, its role in the body and brain is complex. Serotonin syndrome, a condition that arises from too much serotonin in the body, is one extreme manifestation that can also induce anxiety, although it is relatively rare with proper medical oversight. The interactions between SSRIs and serotonin receptors are complicated. Notably, serotonin interacts with various types of receptors, including the 5-HT1A receptor. During the initial stages of taking SSRIs, these receptors may become overly active before eventually downregulating or becoming less sensitive, which typically leads to a decrease in anxiety symptoms over time. Additionally, SSRIs may bind to other receptors involved in stress response, such as cortisol receptors. By binding to these receptors, SSRIs could potentially cause or worsen anxiety symptoms temporarily. Another factor that needs consideration is the first-pass effect or first-pass metabolism. When SSRIs are ingested orally, they pass through the liver before reaching systemic circulation. During this process, a significant amount of the medication might demetabolize, altering its potency and possibly its side effect profile, including the risk of increased anxiety. This metabolic process could influence how quickly or effectively the SSRIs exert their action, potentially affecting the initial anxiety response. In the longer term, discontinuation syndrome is also a factor that can mimic or exacerbate anxiety. When patients stop taking SSRIs, they can experience a range of symptoms that include not only anxiety but also mood swings, dizziness, and irritability. This syndrome further complicates the relationship between SSRIs and anxiety, and it underscores the need for careful medical supervision when modifying any SSRI treatment regimen. Given the complexity of SSRIs' interactions with various neurotransmitters, receptors, and metabolic pathways, individual responses can vary widely. Therefore, it's essential to consult healthcare providers for a personalized treatment plan tailored to your specific symptoms and medical history. Monitoring any increase in anxiety when initiating an SSRI regimen is crucial for optimizing your mental health treatment,